Welcome to Women Mastering Midlife, where we dive deep into the rich complexities of womanhood in our middle years. I'm your host, Victoria Byrd, a pharmacist, certified women's health coach, and your guide on this transformative journey. Whether you're navigating perimenopause, thriving in menopause, or mastering midlife's many transitions, this is your weekly dose of expert guidance, compassionate support, and a judgment-free space to explore it all. Here, we're empowering women to master midlife on their terms, reclaiming our health, our happiness, and our power. Together, we'll rewrite the narrative around this remarkable stage of life, from something to dread into a beautiful, bold transition. I'm so glad you're here. I am so excited to have Dr. O'Sullivan back. Thank you so much for being willing to come back onto the podcast. And I think a lot has grown and evolved with Women Mastering Midlife and myself, and we have stayed in contact. And I just love what you're doing, and I so appreciate all that you're doing for women's health, menopause, perimenopause, midlife, all the things. And now you're launching your own podcast as well. So if you are enjoying listening to Dr. O'Sullivan, she and a couple other wonderful women have come together to make a podcast of their own. So she'll have to talk about that a little bit too before we leave this conversation. But today we're talking about perimenopause. There's so much out there about the menopause space and the menopause movement. And I feel like perimenopause is kind of lumped into that, but there isn't the same standard of care. There's no guidelines to how to navigate it. And a lot of doctors, while they're starting to understand menopause, there's still there's not that grip on perimenopause yet. So I hope today with our conversation, we can shed some light on what women are experiencing and how to take care of themselves and what they can do to advocate for their own health in the process. So thanks for coming on.
Oh, thanks for having me back on. And thank you for all the hard work that you're doing to advocate for women and take care of women during this time of life. We need all of us in this space.
Yeah.
Perimenopause, you're right. It's so vague because, even me as a doctor in medicine for 30 years now had never really heard of that term until a few years ago. I was like, perimenopause, what is that? And I think it's because of the medical terminology that we're taught in medical school and residency. If you're taught anything, you're taught pretty much one word, menopause. And that means, one day in time where you look back and you have not had a period in 12 months. And that can be associated with hot flashes and night sweats and maybe some dry vagina. And that's it. That's about the sum total of your teaching. And so I think every doctor that you meet thinks of, I get a lot of patients coming to me saying they've been to see their doctor. They've told them they have all the symptoms you could have. And the doctor said, well, you're still having periods. So you're not in menopause and there's nothing we can do until you're in menopause. Or you're still having periods, here's the birth control pill to shut down your ovaries to give you some relief. And that's kind of it.
Yeah. And I remember going to my doctor. I don't know if it was 40 or 41. Well, so I was on the pill forever. I was one of those, I was on the pill until I went off to have kids. And then as soon as I was done having kids, I went back on the pill. And I was on the pill forever. And it was continuous with no withdrawal bleeds. And all of a sudden I started having these weird bleeds and weird symptoms. Even though I was taking it regularly, I wasn't taking any medication that could interact with it. There was no reason for me to have these random bleeding periods while I was on the pill. And so I stopped it, went into the doctor, and I was like, what's going on? And she's like, well, maybe it's just time to change to a different pill. And, oh, you're having trouble sleeping, here's some trazodone. And, oh, we'll do your blood work. And my thyroid came back fine, and my hormones don't say I'm in menopause, and all these things. And I knew there was something more to it, but nobody was telling me what. And then when I went off the pill completely for a few months, I started becoming drenched. And my periods were coming it'd be 40 days, and then it would be 7 days. And I never knew when it was going to come or how long it was going to last. And nobody had an answer.
Yeah, it's really difficult for women. Like when you think about what we go through just in life in general, bleeding every month for a week from the age of 12, when you look at boys and they have nothing like that to cope with, you know, and you're trying to do your swimming and your sports and everything and bleeding at the same time, sitting exams, bleeding. And then we're trying not to get pregnant. And then we're trying to get pregnant sometimes. And then we're carrying a baby, birthing a baby, taking care of a baby, maybe breastfeeding. And then the next thing, this perimenopause hits. I mean, it's a lot. And I don't know about you, but I can't remember one time in my life where I was horribly sick with a flu or COVID or something, and I didn't, on top of it, get my period. Like, it's just the worst.
I know. I mean, I was experiencing, I haven't had a period in like, I don't know, 65 days or something. And then, you know, I'm experiencing this rough patch in life. And of course, I got sick and I got my period. And I was like, are you kidding me? I'm coughing. I have no voice. I'm dealing with life. And all of a sudden now I'm bleeding. Thank you.
It's not enough that I'm coughing so bad, I'm peeing myself. Now you got to add bleeding in on top of it. Like, it is just so awful. Or, you know, even just going on a vacation and the bleeding starts. And so when, at least in our reproductive years, for a lot of women, it's kind of regular. You know, they know when it's coming. But perimenopause is so difficult. Will we just talk a little bit for a minute about what it is, what actually is happening inside the body?
That'd be great.
So when we are in utero and we're a female fetus and we're developing and we have ovaries, we have millions of eggs, and they're all the eggs we'll ever have. Men make new sperm every day. Women are born with all the eggs. When you're born, you're probably born with about 1 to 2 million eggs. And then by the time you have your first period, you're probably down to about 250,000. And you lose eggs every single month from then on. And then when you finally stop ovulating and releasing an egg each month, and you do that for 12 months, no ovulation, then that is menopause. And so what happens during perimenopause is, and it's different in each of us, for some women it'll be in our 30s, for some our 40s, for some 50s, that ovulation each month is becoming less and less regular. Some months you're getting an egg released, and some months you're having 2 eggs released. You know, it could be. And so your period, your bleeding depends on that egg being released very often. And sometimes if you don't have an egg released for months, but the lining of the uterus is still getting thicker and thicker in preparation for possibly an ovulation and pregnancy, then at some point, sometimes the lining of the uterus can get so thick that it just falls off. Nothing to do with hormones. It just can't sustain itself any longer. And so you have this massive, heavy hemorrhage with clots, and it can be painful. And so women are going through a lot during perimenopause. And that's kind of the underlying reason. It's our egg supply.
Yeah, and I've noticed I wear an Oura ring every day. I've worn it for years, and I attached it to natural cycles. So it takes my basal temperature every day for me, because if I had to use a basal thermometer and remember, I would never do it. But it tells me when I'm ovulating, and it tells me when I've ovulated. So it tells me what my fertile period would be. And I will go a very long time in preparation for ovulation because it never happens. And then I will bleed. And so they're like, you had an anovulatory cycle. And so it helps to understand that that's basically my body just being so, like my lining being so thick it has to shed, because that makes more sense to me than just what causes that anovulatory cycle and what hormones are at play. And I think also it's I think about a factory and how like the factory is starting to shut down, and then it just like blasts a little bit of energy and then it stops a little bit, because that's how you end up with multiple pregnancies. You end up with twins in perimenopause. Could you imagine?
No, I could not imagine. No. Yeah, those times where you are not ovulating, you know, your estrogen can get very high and you can feel really bad. You know, breast tenderness and irritability, spotting, and feeling really bloated. And then your period finally comes and you finally feel a little bit better. But, you know, during our reproductive cycle, really, day 1 is when you start to bleed, and day 28 is the day before you start to bleed. And so those first 2 weeks, day 1 to day 14 being ovulation, you should get this nice wave of estrogen. And then the second 2 weeks, you tend to get a nice wave of progesterone. And so you can imagine if you're not ovulating, then you're not getting those nice waves. And instead, you're getting big peaks and big troughs. And women do not feel well when their hormones are doing that.
Yeah. I think for me, the first thing that I really needed was progesterone. I just needed some progesterone supplementation. My sleep was terrible, especially around my period. I would notice it got really bad. And then, but my practitioner put me on an estrogen patch and progesterone. And it was a really high level estrogen, because we started at, I think it was like 75 micrograms is where we started. And then 100 milligrams of progesterone, micronized progesterone at night. And the progesterone wasn't high enough, and the estrogen, I was still having symptoms, so she raised it. So I was on a 100 microgram patch of estrogen, and then I was on 100 milligrams of progesterone, which wasn't working. I was having really bad breast tenderness. I felt like I was gaining weight and I couldn't lose it. And so we upped my progesterone so that helped my sleep, but then I was still having all the symptoms of too high of estrogen. So at about day 5 of my cycle, I went in and had blood work, and my estrogen was at like 225. On day 5 of my cycle, which I think looks like it should be around like 40 is what I was reading. And so it was way too high. So then I just like ripped the patch off and was like, I'm just going to go with progesterone. So I was self-treating myself with the little knowledge I had and the little experience I had, trying to figure out how to balance what my body's still producing and what I needed to supplement. And the progesterone helped, but I was still having the night sweats and the hot flashes like crazy. So now I've gone back onto a patch of 50 micrograms and the 200 milligrams of progesterone. And that seems to help. But I also noticed that I was having, I guess they're called loop cycles, where I was having I was constantly having a period. So it was like 11 days and then 17 days. Like I was constantly hitting that I was hitting my cycle again. And so could you explain a little bit about what that is?
Yeah. So when you look at a graph of women's hormones as they go through the menopause transition, which the first part of which is perimenopause, what you notice is that the first thing to drop is their progesterone. And so when you are in that first 2 weeks of your cycle, so day 1 is the first day of bleeding. So you're back to what's called the follicular time of that cycle. And so your ovaries are bringing eggs to the surface of the ovary, and the supporting structures of those eggs are producing estrogen. And so over time, as this is happening over those 2 weeks, your estrogen levels go up and up and up. And then what's supposed to happen on day 14 is that that egg gets released. And then those supporting structures that were holding the eggs on the surface of the ovaries, they collapse down and they form something called the luteal body. And the luteal body is what is supposed to produce progesterone. And that produces progesterone then for the next 2 weeks, and you get your nice wave. Then everything drops and you start to bleed. So if you are stuck in a cycle where you are not ovulating, you are stuck in that follicular phase. And the lining of the uterus is getting thicker and thicker in preparation for ovulation. Your estrogen is getting higher and higher and higher. And you're not producing any progesterone. And so, like what happened with you, you could tell the progesterone was what you needed. And you were right. And so what we see is women will come in with either all of the above symptoms or some of the following symptoms. So the progesterone-related symptoms tend to be anxiety, whether that be new anxiety or worsening anxiety, and also difficulty getting to sleep, initial insomnia, initially at the beginning of the night. And then when you give a woman back that progesterone, we normally give it back in the form of micronized progesterone. So it's hard to get progesterone into your system. It doesn't get well absorbed through the skin. If you wanted to get it in enough to protect the lining of the uterus when you're giving someone estrogen, then you would have to slather it all over you from head to toe every day. Like, it would be a lot of cream. So we tend to not use progesterone cream. Then you could try it by tablet, but it tends to get destroyed as it goes through the digestive system. And so they found a way to smash it up into tiny pieces, suspend it in peanut oil, which many people are allergic to, unfortunately. So you have to compound it. And that is the way we get progesterone into our system. And so as it is metabolized, as it goes through our system, it goes through the liver, and the liver can convert some of that micronized progesterone, which is identical to the progesterone our ovaries make, absolutely identical. It can convert some of it to allopregnanolone, which is another molecule, which then crosses the blood-brain barrier and acts on our GABA receptors in the brain, which is what Xanax works on, and trazodone, and all our sleeping tablets and all our anxiety medicines work on GABA receptors. They're responsible for rest and relaxation. And so the progesterone does that. And that's what you're missing often in perimenopause. So I do have a lot of patients that just need some progesterone to start with. But then, you know, those night sweats and hot flashes, we tend to, if we know anything at all, what we think we know is that that's because of low estrogen. But actually, it seems to be more to do with changing levels of estrogen. So the way it's going up and down, our body doesn't like that. So if you are going to start someone on estrogen in perimenopause, it's not a bad idea to stack them. So maybe to start with the progesterone first, if your patient is complaining of mainly kind of progesterone symptoms, so the anxiety, difficulty getting to sleep, and then when they're up and running on that and feeling a bit better, you could add in a little dose of the estradiol and see if that helps them, because you're not trying to get high levels of estradiol. All you're trying to do is avoid the big lows. And so I would describe it as topping you up with a quarter tank of gas.
Okay. Just
so you're not getting those lows. So you're not trying to, you know, that's possibly what happened with you with the 75 microgram. Yeah, it was just a little too much for you because you probably already had really high estrogen levels, you know, but they were high 1 minute and low the next and high and low. And so in perimenopause, it's much trickier as a menopause practitioner, like to help women. It's trickier than when you're menopausal and you're not making any of your own hormones. And then whatever I'm giving you is what you have on board. And it's much easier.
Yeah, so we're complicated.
We are. We're like finely tuned little engines.
Oh, well, one of the things that I recognized early, and of course I turned 40 July of 2020. So we were like thick of COVID. So you can't tell I couldn't tell like what was my hormones and what was just anxiety about life. But I would wake up at 3 o'clock in the morning, wide awake and terrified. Like, how are we going to pay our bills? Oh my gosh. And I would go through, and I knew rationally how much money we had in our bank account. I paid the bills. Like, I knew we had plenty. It was fine. We were fine. But there was something in my brain that just made me feel so insecure about it that I started like doom dropping about it. And it was completely irrational. And I would tell my husband, I'd wake him up at 3 o'clock in the morning. He's like, we're fine. Why are you even worried about this? And then he could just roll back over and go right to sleep like it was no big deal. And I'm like sitting there wide awake. And then the other things start, like, what happens if Abby plays on the jungle gym and breaks her arm and it's COVID and we can't go to the emergency room? And so I feel like a lot of it was compounded by the environment we were in. But then I don't know, I might have had the exact same feelings this year if it wasn't, if it was this stage of my life instead of back in 2020.
In all likelihood, I would say you would have exactly the same issue, but maybe different concerns, because what I see is that the anxiety and depression that women suffer going through perimenopause and menopause is different to the anxiety and depression that you see in women who are premenopausal or postmenopausal. It is definitely different. So that anxiety that we were talking about from the low progesterone, it so presents like that. So it is waking up in the middle of the night thinking someone is going to take your children. It is suddenly being afraid to drive over bridges.
Or I'm terrified to drive at night. Yeah.
Exactly. Yeah. These things that you never would have bat an eyelid at before, suddenly being scared to fly. And then the depression symptoms are very much based on loss of self-confidence, a lot of social isolation, often because of that. And women will say, I just don't feel like myself. I don't recognize myself anymore. And honestly, that is different to what most patients who have major depressive disorder come in and say when their depression strikes. And so it's really subtle, but it's there. And there's a professor of psychiatry, Dr. Carney, over at Jayashri Kulkarni over in Australia, who is wonderful and speaks about this and actually put together a questionnaire to help figure out whether someone had your kind of regular depression and anxiety or it was related to perimenopause. So that can be very helpful. You can just Google that, Jayashri Kulkarni in Australia.
Wow.
Questionnaire, yeah.
Yeah, that would help so many women. I think another thing that presented to me that I didn't recognize was the brain fog. And I remember so many times saying, I think I need a test for early onset Alzheimer's or dementia, because I would walk into, and it's not just even walking into a room and forgetting what you were there for, but misplacing keys, leaving a burner on the stove, birthdays. I've been in charge of birthday cards and birthday gifts for every person that we know for over a decade. And now all of a sudden I couldn't remember people's birthdays or phone numbers, or I would forget things like booking a rental car for a trip, but I would do everything else. And so is the brain fog related to the hormones? Is it compounded by the fact that we're all carrying a mental load that is like abnormal for human beings to be able to maintain in this stage of life? What do you think what is that caused by?
The brain fog is truly terrifying. I remember trying to explain it to my husband as when your brain is working normally and you cannot think of a word, because that happens to everybody. It's almost as if you know you're going to find it. It's in there and there's light and there's almost a path you can follow. And when you follow it down, it might be memories or something, the word will come to you. And during perimenopause, it is frightening because it is just darkness in there. It's just empty, dark space. And you know that word ain't coming. Like, it's so scary.
Yeah.
And, you know, I use this example all the time because it actually happened to me where I had to say to my children, what is that thing in the fruit bowl, the yellow thing that you peel and eat? And they were like, do you mean a banana? It's like, yes, I literally could not remember what a banana was called. So I truly thought I either had a brain tumor or early dementia, which is what I hear from my patients all the time as well. And it sounds like you went through the same thing.
Yeah. Or I had a stroke or something. I was like, why can I not put this sentence together? And my words would get jumbled and I would feel like I'm chewing on a sentence, like I couldn't get it out. And I was trying to figure out what in the world was happening with me because it just felt so not okay. Like I knew my brain was working, but things weren't coming out the way they were supposed to.
Yeah. When it really hit me and upset me, truly made me realize I can't go on like this, was I have been a doctor for a long time. And, you know, in every single job I've ever worked in, my employer has asked for reviews afterwards, you know, and I've always had really lovely reviews from my patients. And one day I got a review from a patient who said, I just couldn't trust anything that came out of her mouth. She just didn't seem to know what she was saying. And I remember that distinct appointment because I could not find my words. I could not think what I wanted to say. I was halfway through a sentence. I couldn't remember the rest of it. And that was the day when I read that review from him that I went, I need to do something about this. I need help. If I have a brain tumor, then I need to go find out and have it removed because I cannot function anymore. This is my livelihood. This is my whole life. Seemingly, I've wanted to be a doctor since the day I could talk. And here I am now, and I can't even speak to patients or remember what I want to say to them. So it is truly, I just want to empathize with anyone listening to this who's going through a similar thing. It is truly frightening. and I wouldn't wish it on anybody. And Dr. Lisa Mosconi is a neuroscientist over at the Weill Cornell Medical Center, and she does research on women's brains. She has a very strong history of Alzheimer's dementia in the women in her family. And so she has a vested interest in getting to the bottom of it if possible. And she does functional MRI scans on women's brains pre-menopausal, perimenopausal, and postmenopausal. And you would not believe what is going on in the brain during perimenopause. We get a 30% drop in brain energy. So you are not imagining it. You are not going crazy. And if men had a 30% drop in their brain function,
they would have figured this out already.
Oh my God, absolutely. This, so it's awful that we've been led to believe that we should just put up with this and things will get better after menopause. I mean, for some women, that started for me when I was 40. I'm 49 now. So really, I'm still having periods every month. Never changed. My periods were always regular. So if I didn't have a clinician who had listened to me, I don't even know if I would be here today, honestly. It was so bad.
Yeah.
But I'd be 9 years into that now with no help. And I probably have left medicine because I wasn't able to function properly. I'm sure I'd have lost my marriage because I'd be curled in a ball on the floor most days, no energy. So we really need to get with the program here. Women are being harmed by us clinicians not being taught this in our training.
Yeah. And I wonder, our generation is one of the first to really have a lot of women in high level powers at work and big businesses. And you see women saying that they couldn't do their jobs anymore. And now they're starting to educate menopause in the workplace. But for women about to give a presentation to a board and they can't think of words, it's so demoralizing. And you're smarter than that and you're more capable. And to have people just staring at you while you're trying to figure out what you have to say, I can't imagine. I'm hoping the conversation opens up to people now a little bit more. And there is more training in the workplace about these experiences for women and a little bit more grace.
Yeah. Exactly. And you're right. That's the only reason things are changing, right? Because women in medicine, women who are working, women who just are alive and going through this, they actually, most of them have some money of their own. They have a job, that they have a family very often. And they're like, yeah, I can't do this. This is not going to work for me. I need to take care of things. And so really the first generation of women who have been able or in any position to do anything about this.
Yeah. Yeah, you hear those stories of like the hysterical women and the crazy housewives of like the 50s and stuff. It's like, well, maybe they just weren't helped.
That's exactly what happened. Yeah. When you go back into those old diagnoses in the oldest books of medicine and the names that they called what women were going through during this period, hysteria, admitted to psychiatric units and never came back out again. It's horrifying, the history of it all. Yeah.
Yeah. Well, and to name a hysterectomy, because, like removing the hysteria from women is by taking their female reproductive organs out. Really.
Mm-hmm. Yeah, it's maddening.
It's so frustrating.
We got some rage on here today. I'm here for it.
Little bit of meno rage. Well, there's also, and that's another thing, the rage component. I know there are times when I lost it with my family, or even just like by myself in the house, and the dogs would irritate me and I'd be yelling at the dogs. But it was a moment of like, afterward, I felt so bad. Like, this isn't me. I'd have obviously apologized, but there was no seeing it coming. And it was completely irrational and uncontrolled. And I know a lot of women, and it also, I feel like the more stressed you are and the more anxious you are about other things going on in life, the more it happens. But women who feel very even calm and work on meditating and breathing techniques and all the things, they still have these bouts of rage that they don't understand and they feel uncontrolled. And that seems to come a lot in perimenopause.
Yeah. So what we're not taught anything about is how important our hormones are in our brain.
Let's take a quick pause because if you've been loving these conversations and you're ready to take things deeper, I have something special just for you. The Women Mastering Midlife community is open for enrollment and it's better than ever. This is your space for real, whole person midlife wellness. We focus on 5 pillars: movement, nutrition, lifestyle, stress management, and rest, because midlife health is so much more than just workouts or what's on your plate. Inside the community, you'll get strength training programs that actually fit your life. No 5 a.m. workouts required. Weekly accountability check-ins, meal plans, recipe guides, live group coaching with me, a private forum where you're never alone, and direct access to message me whenever you need support. Normally, it's just $29 a month. That's less than a single personal training session. But because you're part of this podcast family, I've got a gift for you. Use the code PODCAST5 at checkout and you'll get $5 off every month, making it just $24 a month to join us. You'll find the promo code and the link to register right in the show notes, so it's super easy to get started. Come join us and step into midlife feeling strong, supported, and unstoppable.
Our brains need testosterone, estrogen, progesterone to function properly. And when we don't have them, these are the consequences. So this is not because you didn't get a good night's sleep. This is multifactorial. You know, it's the loss of hormones in our brain where we so desperately need them. And we used to think, again, this is from Dr. Mosconi's research, that during menopause, we kind of lost estrogen receptors in the brain. And that's why it wasn't as responsive and active as it used to be. But from her research, it looks as though we actually ramp up expression of estrogen receptors in the brain. It's literally just trying to grab onto any molecule of estrogen it can as it goes by in the bloodstream. That is the opposite to what we thought happened. So, you know, our estrogen, testosterone, progesterone, they all work with our neurotransmitters, with serotonin, with dopamine, with norepinephrine. All so vital to our mental health. And that's why when we're lacking them, we see those symptoms that are very similar to depression and anxiety, because they're functioning in our brain basically as, you know, our happy hormones.
Yeah.
Yeah.
So for women out there listening and they're starting to think that this might be something they're experiencing and they aren't quite yet sure that they're in perimenopause, what are some things that you tell women to be on the lookout for, some early signs for themselves to notice?
Yeah. So I think it's nice to see things in black and white. Dr. Louise Newson is a family doctor in the UK and has set up the most beautiful free website for women and clinicians. And so on there, she has a questionnaire that I love to use with patients. And it has a whole range of questions on there, 23, and then you score them from 0 to 3. And even if you did that once every 6 months, you'd be able to see changes and spot things happening before they got out of hand. And so the questions on that and things you might notice would be, the first things that come into me with my patients are generally mood changes. So low mood, low energy, feeling irritable, lack of self-confidence, not feeling like yourself, and new or worsening anxiety. Those are the big ones. The next biggest one would be probably not being able to get to sleep at nighttime. And then anything else. So a lot of women will notice they get tinnitus, which is ringing in your ears, or they have these weird symptoms like they feel lightheaded or a pressure in their head, which is all new. Vaginal and pelvic wise, you can get vaginal dryness very early on in perimenopause, especially if you've been on the pill, because the pill can increase production of a protein called sex hormone binding globulin, which can go around and kind of trap all your free testosterone, which is really important for a healthy vagina and vulva. So you could notice vaginal dryness, discomfort with any intimacy especially, urinary tract infections can be a big issue for women as well. And then recurrent infections like BV or yeast infections, because as we lose our hormones down around the pelvis, we're getting these massive changes. And one of them is that it's supposed to be very acidic down around the vagina and the vulva, and it becomes less acidic during perimenopause. And that's when we start to get all these issues. And then our vasomotor symptoms. So I think a lot of us think of these as a skin issue, but actually it's from the hypothalamus in your brain. This is a brain issue. Your brain does not like levels of hormones going up and down rapidly like that. They like things to move slowly. And so when you get these fluctuating levels of estrogen, the hypothalamus reacts badly to that, and it shows up as hot flashes and night sweats. They are quite dangerous for your brain. There's a study going on called the SWAN study, which is the study of women's health across the nation, where they're looking at women over a long period of time since the 90s. And what they see with women who have hot flashes, when you MRI their brain, is they get these tiny little areas of hypointensity. Now, hypointensity is something you see on an MRI when someone has a stroke.
Okay.
So when we have hot flashes inside our brain, it's basically like having tiny little strokes. So you do not want to be having hot flashes and night sweats for any length of time. So if those start happening to you, and that can show up as feeling very hot in bed overnight and having to throw on and off the covers, you don't have to wake up in a puddle of sweat. Just, get the questionnaire, keep an eye on it once or twice a year. And when you start to see any of these things happening, that is a good indication that might be time to talk to your clinician about starting on hormones, because the underlying issue is our ovaries didn't get the memo that we don't die at 50 anymore or 40. Yeah. We live a third to a half of our lives now with no hormones, and we don't do well. Most of us, sometimes you meet the odd unicorn, but most of us don't do well like that.
Yeah. I always thought that a hot flash would mean like my whole face would get flushed and I would be sweating profusely. And I remember the first time I had one, we were in Whistler and I had on like a turtleneck and a jacket and I was fine. And then all of a sudden I wanted to just rip everything off of my body instantly. Like I was handing people my coat and my scarf and my hat. And I was like, okay, if I take anything else off, I'm going to be arrested for obscenity. But I didn't present in that what you see on television of somebody having a hot flash. I didn't even look flushed. I mean, my mom said I looked like I was ready to rip my skin off, but it was just this intense feeling of like, I have to get out. And I almost felt suffocated by my clothes and I just wanted to get everything off. And another thing I experienced was my front tooth. I had this horrible pain in my front tooth for the longest time. It was so weird. And then when I went on hormones, it went away. The dentist never did anything. I never changed anything other than my hormones. And now my tooth is fine. I thought my tooth was going to fall out. It was just this weird feeling in it. It was kind of painful every now and then. And it just felt like it was going to fall out. And now it's fine. So I don't know.
I know some women, it's just their ears that go red. And they don't get the whole hot flash or sweats or anything. So it can look different for different women. And then about the teeth, you do get changes in your mouth as you go through perimenopause and menopause. So if you look at a bone scan of a woman as she's going through perimenopause and menopause, it changes dramatically. So usually the cells that build bone and the cells that break down old bone are pretty evenly paced. And you get breakdown of old bone with replenishment of new bone. As you go through perimenopause and menopause, the cells that break down bone go into hyperdrive. And so you're getting bone breakdown. And we tend to think of that as showing up as hip fractures or fragility fractures in the spine. But what we don't think about is, what's our face made up of?
Yeah.
What are our teeth set into?
Yeah.
Bone.
Yeah.
So we get resorption of bone in our skull, in our face. And so that's one reason for us to have gum and dental changes. And the other is that estrogen in particular is anti-inflammatory. It keeps us in an anti-inflammatory state. And as we go through perimenopause and menopause, as the levels drop, we get more inflammatory conditions. Women will suddenly develop inflammatory bowel disease, rosacea, psoriatic arthritis, all these, Sjogren's syndrome, these skin dermatitis, can't remember the plural, skin conditions, and all related to inflammation. So that's the connection between the dental issues, both of those things.
Yeah, that's crazy. And I didn't have tinnitus, but I have itchy ears. Like I would be driving and I just want to stick something in my ear to get it to stop itching. And that was one of the most annoying things because there's nothing attractive about needing to constantly itch your ear.
It's really common. And it's because during this transition, we lose massive quantities of collagen and elastin in our skin. So our skin gets thinner, the blood supply is not as good, it's drier, and we get itch. And that can be anywhere. But the ear canals are a really common one. The poor ENT doctors see that all the time.
Oh, it's the worst. Yeah, I noticed that, as I've gotten older, having teenage daughters with those, they wake up with the rosy cheeks and the color to their lips. And it's just so youthful. And then I'm like, if I don't have something on my lips, I look like I don't have them because they're so pale now. And I don't, I have to add a little bit of something to the face to give myself that rose, unless I'm hot, which is the only time I ever have flush. But, you do lose some of that. And so that's the only time I want to talk about aging and beauty, is the fact that you do lose that color pigmentation and that natural flush about you. Yeah, it's just not fair. There's so many things.
Honestly, let's just be real honest and say it is not fair. It is not fair how one gender gets all of these issues to deal with for their entire lives from the age of 9, 10, 11, 12, and the other literally have nothing.
I know.
Nothing. It's phenomenal how that worked out.
I know. They say Mother Nature, but I'm beginning to wonder if Mother Nature was a man because...
Oh, yeah. When people talk about God, I'm like, no, if there is one, it's definitely a man. Definitely. There's no question.
Oh, it builds resilience and strength that we have that nobody comes close to than women. But I'd rather not have all of it, honestly.
No, me too.
I could share some of this burden. I'm good. But yeah, I think that there's a lot of things that hopefully are still coming. The research, we're getting more money for research grants for women's health. And I think that now that drug companies are seeing how much money they could make off of us, maybe they'll start making some products that are FDA approved that we could purchase, like testosterone. And let's take some black box warnings off of things.
Yes.
And don't get me started about the fact that testosterone is a controlled substance because, it just pigeonholes women even farther. I mean, the fact that it's not indicated for women in the United States and there's no products for women and that it's a controlled substance, it's just one more thing. Yeah. So hopefully the next time we talk, there'll be even more that's coming out for women and more research being done and some more light being shed so that we don't have to feel so in the dark. And hopefully this episode helped women who are still having periods or who aren't in menopause but know there's something wrong feel a little less alone and terrified and know that they can talk to a practitioner and actually get some help.
Yeah. In my link tree, in my Instagram, Portland Menopause Doc, I have a bunch of fabulous papers. And so if you're a woman who has gone to her clinician and hasn't been able to get any help, but thinks you might be able to go back and discuss it with them, like they didn't totally shut you down, there is a paper called, I hope I get the name right, Contemporary Management of Hormone Therapy. It's by Dr. Jim Simon and Dr. Rebecca Levy. And it came out last year and it is fabulous. It's a short and sweet paper that breaks down the research that we have on hormones, explains how safe everything is, and it's a great place to start. So if you feel like giving your clinician a little early birthday present, you could print that out for them and say, listen, would you mind having a read of this? Because I really need your help. And I know that this is not taught in your training, and I understand that. But would you mind reading this 2-page, article, and maybe then we could talk again? And I would hope most clinicians would be very open to that. It's really hard in these 10 and 15-minute visits to do anything. doctors are under tremendous strain and medicine is no longer pleasurable anymore because of these hospitals and private equity companies that have bought up everything, and you're just a cog in a machine. So, I do understand that some clinicians don't react well when we go in talking about our perimenopause, but I do think to give them one chance and ask them if they'd read that paper, I think that's worth it, rather than going off to try and find a totally new person to help you and starting from scratch.
Yeah, it's not a 20-page manifesto. It's 2 pages. Come on. You could read 2 pages. I mean, they're capable. And also, so your podcast, we cannot end this conversation without talking about your podcast. Tell us a little bit about this, because I was telling you before we started recording, I saw on LinkedIn that you announced it, and I was like, oh, I need to know more. So tell me about this podcast.
Oh, thanks so much. So Dr. Rebecca Hurtle, Dr. Christine Hartcrest, and I all worked at the Heather Hirsch MD Collaborative, and that's how we met. We all trained under Heather Hirsch as well. And we worked on a few things together and became fast friends. And we found ourselves on the phone, or at least texting, every single day, talking about different articles we'd read, different studies, asking questions. And at some point said, do you know what? We should just spread this information, because we're talking about so much cool stuff that a lot of other clinicians and women don't know, and ended up forming that idea into a podcast. And so it's called The Dusty Muffins.
That's awesome.
All 3 of us have had dusty muffins at some point or another. And it's supposed to be basically 3, kind of like listening to your 3 girlfriends talk about the perimenopause and menopause, but it's actually chock full of really great information as well, and resources. So a really easy listening if you're commuting or walking the dog or doing the washing up.
That's wonderful. So after they listen to this, then they can go head over there and they can check out your podcast. Thank you so much for coming back and talking, Dr. O'Sullivan. It was a pleasure. It's always a pleasure to talk to you.
It's always my pleasure to come on and chat.
It's so fun.
Thank you.
So this is my guilty pleasure, is being able to record. Like, I have a reason to have these conversations with other women. Like, how lucky is that? So
I know.
Thanks for coming on.
Thanks for having me.
Thank you for listening to this episode of Women Mastering Midlife. If something you heard today resonated, I'd be so grateful if you'd share it with a friend who might need a little extra support on her midlife journey. Remember, small changes can make a big difference, and you don't have to navigate this transition alone. We will be back next week with more expert guidance and compassionate conversations to help empower you to master midlife on your terms. Until then, you can find us on Instagram at Women Mastering Midlife, or come connect with me directly at Miss Victoria Byrd. And you're looking for deeper connection and support, be sure to join us in the Women Mastering Midlife community. We'd love to continue the conversation with you there. If you've enjoyed this episode, please rate and review this podcast. It helps us reach more amazing women mastering midlife just like you. You'll find all the links from today's episode and ways to connect in the show notes below. See you next time.